channel here at Antai Hospital, and in today's video we'd like to talk about what makes a PCOS patient different from a healthy individual. So as we all know, PCOS is a hormonal imbalance disorder caused by abnormalities of the ovaries. Now, the key differences between a healthy individual, somebody that does not have PCOS, compared to somebody that has PCOS are definitely the physical symptoms. So if you compare the two, let's say we have two individuals, physically they are slightly different because they exhibit symptoms for the PCOS patients. Now these PCOS patients will exhibit symptoms such as acne, they will have obesity, they will have rough patchy skin, and then they also will have irregularities in their menses cycle. This is an easy way to indicate who has PCOS and who doesn't have. And a healthy individual will not have an abnormal cycle. So what I mean by that is that they will have a very long cycle, up to 45 to 60 days, whereas a healthy individual will have 28 to 30 days. And they will ovulate 5 to 6 times a year instead of 12 to 13 times a year. And these people also will experience fertility problems. And they will have high levels of testosterone, insulin, and estrogen, these three key hormones, as compared to a healthy individual, which will have a slightly lower and also stable level, whereas these patients will have very high levels of these hormones causing all these symptoms that we know. And it also has correlations in causing mood swing, aggressive behavior, and also depression as well amongst patients who have PCOS. And all this can be traced back to the condition causing a long-term hormonal imbalance causing high levels of testosterone, high levels of insulin, high levels of estrogen, causing them to unable to lose the weight. They gain a lot of weight, they have patchy, oily, acne skin, and then they also have fertility problems. All can be traced back to the presence of these abnormal testicular tissues within the ovaries. So as compared to a healthy individual, they do not have this abnormality, whereas PCOS patients, within their ovaries, they are abnormal Leydig cells. Presence of these Leydig cells causes secretion of high levels of testosterone, and is actually the root cause of PCOS. No amount of pills or herbs can actually eliminate this condition. The only way to effectively treat this condition, how we do it here at Antai Hospital, is by removing this abnormal presence, dealing it at the root cause. We use 3D laparoscopic surgery to remove this abnormal presence, and upon completion of surgery, 7 to 10 days, you will realize your cycle gets to restored again, your mood swings go away, and your weight seems to be easier to lose this time, and your physical symptoms all subside. All is directly correlated to the presence of this abnormal presence of Leydig cells. So that's why surgical treatment is the only effective treatment for PCOS. Short-term wise, you can depend on pills and herbal medication, but if you do want to get pregnant, you do want a higher quality of life, you do want to eliminate this condition, you need to emphasize surgical treatment. This treatment is offered here at Antai Hospital with a full refund guarantee for all patients seeking treatment for PCOS. We offer you full refund guarantee if you still experience these symptoms, or if you are still experiencing problems with pregnancy, miscarriage, and infertility. So I hope this video has helped you, and also please visit the website, leave us some feedback down below, and I'll see you in the next video.